Good evening, everyone, and welcome to an introduction to Public Fertility Care donor egg and sperm program. My name is Katie Beveridge. I'm the Operations Manager of Public Fertility Care here at the Royal Women's Hospital. Thanks, Julia. Now, we honour and pay our respects to Elders past and present. We recognise all Aboriginal and Torres Strait Islander people and their ongoing strength and resilience despite the past and present impacts of colonisation and dispossession. We acknowledge the important role that Aboriginal and Torres Strait Islander young people play as leaders in their communities and across Victoria. Aboriginal and Torres Strait Islander people represent the world's oldest living continuous cultures. We celebrate and respect their continuing cultures and strive to empower Aboriginal and Torres Strait Islander young people as they draw on the strengths of their community, families and culture to build a bright future. So just wanting to give you an overview of this evening's session. I'll be first of all speaking to you all about public fertility care, the costs, eligibility criteria and the waiting times. We'll then move on to hear from our Co-Medical Director of Public Fertility Care, Associate Professor Dr. Wan Tin Tay, who will speak to you all about treatments, options and pathways of the donor program. We'll then hear from our clinical nurse consultant of the donor program, Priscilla Buswell, who will talk to you about the egg and sperm donor program and what to expect as a patient. I just wanted to also say thank you for registering your curiosity on public fertility care and the donor program. And we will have a question and answer section at the end. So please reserve any questions that you do have till the end, because we do hope to cover information throughout this presentation that may answer some of those questions along the way. So Public Fertility Care is a Victorian government-funded fertility service available to all Victorians. It aims to make fertility treatment fairer and more affordable for Victorians, particularly those with limited access to existing private services. It's a free service. However, some patients may have some out-of-pocket costs for some medications, diagnostic tests or some specialised tests. And this service is not means tested. So the Women's partners with 10 other hospitals across Victoria, so your care can be managed closer to home. So this map shows where our partner sites are located across Victoria and what the 10 different hospitals that we work with are. So, sorry, one moment. Public fertility care is eligible for Victorians who have been unable to conceive or whose circumstances may prevent or impair fertility for safe conception. So whose health may prevent fertility, people that have been trying to conceive naturally but have been unable or been unsuccessful. This includes people who may have already had children. It includes single people and people from the LGBTIQA+ communities. So who is eligible? So you must be a Victorian resident with a Medicare card. You must have a referral from a GP or a specialist, which includes all the necessary tests and investigations, and you must meet the age criteria. So let me explain that to you. So if you're coming through the program using your own eggs, you can have treatment up until your 43rd birthday. If you're using donor eggs, you can have treatment up until your 51st birthday. If you're accessing treatment with a known egg donor, the egg donor must be less than 43. If you have a known egg donor, we also require a GP referral or a specialist referral for your donor. So Public Fertility Care offers a wide range of services, and Dr. Tay will go through some of these in more detail. But just to give you a summary, we do offer, so IVF and ICSI refers to just the different ways that the eggs are fertilised during the IVF treatment. IUI is otherwise known as artificial insemination, ovulation induction, also known as timed intercourse. We offer fertility counselling. Sorry, I missed medical fertility preservation. Sorry, that's where patients might be faced with needing to preserve their fertility prior to oncology treatment. We have our clinic recruited and known donor programs. We offer genetic counselling and altruistic surrogacy. Now, Public Fertility Care has a lifetime limit of 2 egg collection cycles per individual. So if you're accessing the clinic recruited egg donor program, each allocation of donor eggs counts towards your limit of publicly funded cycles. Now, these limit of 2 cycles also includes any frozen embryo cycles that are created from those 2 egg collection cycles. Now, I just want to point out, if any of this information that we're sharing with you tonight is confusing at all, please rest assured, because our team understand that is a difficult and complex process, and we will step you through the journey if you were to come through for treatment. So how to access public fertility care? So the first step is to talk to your GP or specialist. Now, at the time of your referral, when the GP is referring you to public fertility care, if you know at that point that you need to access the donor program, please ask your GP, your doctor, to include that information on the referral. That way we best know how to direct the referral when we receive it. You will need to require to complete required investigations, and then your GP will collate those results and send them with the referral. All referrals come centrally to the Royal Women's Hospital, and then we, on receipt of that referral, will forward it to the closest partner site for your treatment to take place. The current wait time for your first appointment is anywhere from 4 to 8 weeks, depending on which site you're closest to. So you can appreciate the wait time is pretty quick for a first appointment. So this is a photo from the launch of the Public Egg and Sperm Bank back in July last year. Just wanted to highlight that we're currently accepting egg and sperm donations from the Victorian community. The Department of Health have also run some campaigns looking for expressions of interest from potential donors to help build the bank. And this is continuing. It is a very detailed process for someone to become a donor that involves medical and counselling appointments and a lot of screening. Now, Priscilla will go into this in more detail during her section of this evening. Now I'd like to introduce to you Dr. Tin Tay. Hello. Associate Professor Tay is our co-medical director of Public Fertility Care and also oversees our donor program. Thank you, Juan.
Thanks, Katie, for the introduction. Good evening, everyone. So let's start by looking at who the donor program is designed to help. So it supports people who can't use their own eggs or sperm, quite often due to age, medical, or genetic conditions. This includes women born without ovaries or those who have experienced early menopause. The program also helps individuals who've had cancer or treatments affecting their fertility, as well as couple and individuals who's faced multiple IVF failures may also access the program. This program is also available to same-sex couples and members of LGBTIQA+ community, as well as single parents who want to begin their parenting journey. So next, let's talk about the rules around eggs and sperm donation in Australia. So donation must be altruistic, meaning that we can't pay our donors. There are limits on the number of families that a donor can help. This is in place to prevent too many children from one donor. Clinics are also required to report all donor-conceived birth to make sure accurate records are maintained. The recipient parent or parents are legally recognized as the child's parents, so this provides clarity and security for all parties. So when the donor-conceived children turn 18, they have the options to find out more about their donor through the Registry of Birth, Death and Marriage. Anonymous donation is not allowed in Australia. This is to ensure that donor-conceived children can know their origins if they choose to. So all these rules are in place to protect the rights and well-being of donors, recipients, and the children born from these programs. So now we look at why it is important to choose an accredited clinics for donor conception. So I've listed out here a few reasons. So accredited clinics follow strict screening protocols. So all our donors are tested for infectious disease, such as HIV. This is to ensure the health and safety of all parties involved. Accredited clinics also conduct comprehensive genetic screening, which includes health questionnaires, chromosome testing, and genetic carrier screenings. This helps to minimize the risk of passing on genetic conditions to the child. Legal protection are also in place for both donors and recipients to ensure transparency and safeguarding everyone's right. Accredited clinics also maintain an accurate donor registry. So this allows donor-conceived individuals to access information about their donor, such as medical history, and even make contact if they choose to. And lastly, clinics enforce donation limits to reduce the risk of creating too many genetic siblings, which is a very important ethical consideration. So there are a few ways to find a donor. Most people use a donor through the fertility clinic. So this process involves investigations, a waiting list, counseling before the fertility treatments with the clinic donor. Some people may choose to use a friend or family member as their donor. So the process of using a non-donor is quite similar to a clinic donor, except it doesn't involve a waiting list. You can also advertise for a donor, but the advertisements will need approval by Minister of Health under the Human Tissue Act. So your clinic or your fertility specialist can usually guide you through these options to find the best match. The treatment options for donor conceptions depends on individual's medical history, as well as whether you are using a donor eggs or sperm. For those who needs to use donor sperm, you have the options of IUI or known as intrauterine insemination or IVF. This depends on your medical history. And for those who need to use donor eggs, IVF is usually required. So most clinics use frozen eggs, but with a non-donor, fresh embryo transfer may be possible. So the type of treatments is tailored according to individual's specific situation. So I'm going to step you through the treatment process for IUI and IVF. First of all, let's talk about IUI. So IUI is a common fertility treatment. It is a process where sperm is collected, processed, and frozen in the lab in a donor arrangement, and then placed directly into the woman's uterus during her ovulation period. So this helps the sperm get closer to the eggs for fertilization. So how does the IUI treatment cycle work? So it usually starts with either ovulation monitoring or medication. So we might use small dose of ovulation medications to help women's ovulation. And then the timing of the procedure is carefully planned around the ovulation. The donor sperm is usually frozen and ready for use. So our embryologist will defrost the sperm, wash it in the lab to concentrate the best quality sperm for insemination. The IUI procedures involve your doctors using a thin, flexible tubes called a catheter to insert the sperm into the uterus. It is a quick procedure, usually painless for most people, and feels a little bit like a pap smear test. So IUI is generally less invasive and less expensive than treatments like IVF, and making it a common first step treatments in fertility treatments. So let's look at IVF next. Otherwise known as in vitro fertilization, IVF is a type of fertility treatments when an egg is fertilized by sperm outside the body, usually in a lab. So IVF is a little bit more involved, but it is also more effective than IUI. So IVF involves several steps. First step is stimulating the ovaries to produce eggs, followed by collecting the eggs and combining them with the donor sperm in the lab, and then growing the fertilized eggs, or then known as the embryos, in the lab to select the healthiest one, followed by transferring of the best embryo into the uterus, and then a pregnancy test to find out if the treatment has been successful. So I'm going to take you through the process of IVF in a little bit more details. So the first step is to use a hormone called follicle stimulating hormone, or known as FSH. So FSH is a medication used in IVF to stimulate the ovaries to produce more eggs. So it is given as a daily injection starting at the beginning of the cycle, typically on day 3 of your period. Usually around day 8 of the cycle, another medication called antagonist is used. So this is to prevent ovulation until it is time for egg collection. Next slide. So during the ovarian stimulation, frequent ultrasound and sometimes blood test monitor is required so that we can monitor the process to ensure that eggs are developing properly. So here are some ultrasound pictures. The ones on the left of the screen show an ovary that has not received FSH with single leading follicle. So follicle is a term that we use to describe a growing egg. While the ultrasound on the right side of the screen show an ovary that has received FSH hormones with multiple follicle developing at the same time. Next slide, please. So once the eggs are mature, and injections called trigger injections is given, usually about 36 hours before egg retrieval. This is to help the final maturation of the eggs. Your doctor will then retrieve the eggs using a thin needle guided by ultrasound through the vagina. So this is a short procedure usually done under light sedation, and it takes typically about 15 to 20 minutes. So in the lab, the eggs are then combined with sperm. So fertilization can happen either naturally through what we call a standard IVF, or through a process when a single sperm is injected directly into the eggs, a process called ICSI, or intracytoplasmic sperm injection. The fertilized eggs will develop into an embryo over a few days. the lab will monitor the growth of the embryo. The first picture here shows a fertilized eggs with the two arrows pointing at the so-called pronuclei, which is a sign that the eggs has successfully fertilized by the sperm. The second picture shows an embryo on day 3. So day 3 embryo typically has about 6 to 8 cells. The third photo shows a day 5 embryo, or known as a blastocyst. So a blastocyst typically has just over 100 cells. The standard protocol in most clinics worldwide, including our clinic at Public Fertility Care, routinely perform embryo transfer on day 5. And the last photo is a photo showing what we call a hatching blastocyst, which is a blastocyst ready to implant into a uterus. So the best quality embryos is usually selected for embryo transfer, and it is placed into the woman's uterus using a thin catheter under ultrasound guidance. So this is a quick and usually painless procedures, usually done without any anesthesia. If there's any extra embryos, they can be frozen for future use. After egg collections, before the embryo transfer, we usually use a medication called progesterone to help support the lining of the uterus for implantations. This medication is usually continued until pregnancy test. And the medication is typically administered vaginally, like through a pessary, or sometimes as an injection. About 10 days after the embryo transfer, we will perform a blood test to find out if pregnancy has occurred. So lastly, as Katie has mentioned earlier, unfortunately, when a patient turns 43, she can no longer undergo IVF using her own eggs at Public Fertility Care, but she has the option of using donor eggs or treatments at other private clinics who has different eligibility criteria. And finally, just a few points to remember. There is a limit of 2 cycles per patient. This includes IVF cycles using a donor. So we are here to help you understand all your options and support you through the process. Thank you.
Thank you so much, Juan. Thanks for stepping through. Now I'd like to introduce Priscilla, who is our clinical nurse consultant that manages our donor programs here at Public Fertility Care.
Good evening, everyone. I'm here to talk a little bit more about our donor egg and sperm programs, clinic and recipient recruited. So we've got 2 types of donor programs here at the Public Fertility Care Service. We've got the known donor program. This is where the recipient recruits the donor themselves, and this is commonly someone they know. Please be mindful if the donor does need a GP referral to the Public Fertility Care Service to commence this arrangement. Our other program is the clinic recruited program, where the donor is recruited by us. There is quite a rigorous screening process involved. It involves genetic screening, medical appointments, counselling, infectious diseases screening. This is to ensure the safety of the patient, the donor, and any donor-conceived offspring. Currently, the anticipated wait time for access to donor egg and sperm is 24 to 36 months at present. There are a number of criteria that our donors need to meet before they can start the process of donation or the process of becoming a donor. So age-wise, sperm donors need to be between 23 and 46, and egg donors need to be between 23 and 36. They need to be permanent residents or Australian citizens with Medicare. They need to be willing to do health checks. So again, as mentioned, the infectious diseases screening. There's also semen analysis involved for the sperm donors and ultrasounds for egg donors. We also need to make sure that our donors comply with family limits. So if they have donated previously to make sure that they are within the 10 family limit according to Victorian legislation. This family limit also includes their own family. So as a clinic, we've got to apply by some regulations, some rules and regulations. So Juan covered a little bit about this, but I'd like to just go over it again. So all donations are altruistic, meaning that donors cannot get paid for their donation. Donors must be prepared to have their identifying details, so things such as their name, date of birth and contact details registered. These details can be made available to donor-conceived offspring when they turn 18 and ask for this information. Now, the VARTA, also known as the Victorian Assisted Reproductive Treatment Authority, manages the central register. They are being absorbed into a regulatory body in the Department of Health come December 31st this year. As our clinic becomes aware of any changes, we will update our patients and donors with those changes and what they may look like. It is also another regulation is it's mandatory for donors to complete counselling, medical health questionnaires, undergo screening tests and other related testing. Again, donors must adhere to the 10 family limit in Victoria. Donors can nominate to donate to a maximum of 10 families. However, if they wish to nominate to 1, 2 or less, that is also their choice. But this family limit does include their own family. So how to become an egg or sperm donor? So initially what we ask is anyone who is wanting more information about becoming an egg or sperm donor to complete an expression of interest form online. And what that will land in our inbox at the donor program here at Public Fertility Care Service. So we will reach out to you via email and we can organise a time that is suitable for you or convenient for you for us to touch base and to provide some more information. We will talk you through the steps and then we will commence you to do the mandatory requirement of counselling. There are also some medical tests and genetic screening questions that need to be answered. Once we get through those screening processes and finish counselling, we will commence, help you start your treatment and commence donations here at the Women's. All donations, regardless if they're egg or sperm, for clinic donors must be quarantined for 3 months. And then post that 3-month period, there is a post-quarantine screening test, and this is to keep everyone safe and make sure everyone is, all the infectious diseases serology remains negative. Once they are cleared and the post-quarantine period is over, then the donations can be made available for patients to access these donors. Now, for patients wanting access to the egg and sperm bank, as Katie and Juan have explained previously, you need to become a patient of the Public Fertility Care Service. So we need you to send through your GP needs to send through a referral to the Public Fertility Care Service, and you'll have an appointment with one of our specialists. The specialist will let the donor team know that you are seeking an egg or sperm or both, and we will add you to the waitlist. As mentioned, the demand for clinic egg and sperm donors outweighs the number of donors currently available. So there is an anticipated 24 to 36 month wait, but this is subject to change. Once you reach the top of the wait list, the donor team will give you a call and we will start the process of the mandatory requirements for you as the patient, so medical and counselling. We will offer you donor profiles once all of these appointments are available. Once you choose a donor, a profile that you like, then you can commence your treatment cycle at the Women's. Now, if you have a known donor, the wait time is not 24 to 36 months. The donor team can get you started pretty much straight away. But please be mindful, as mentioned, that you do need to be a patient of the Public Fertility Care Service, and your known donor does also need to send through a GP referral. So once you as the patient have met with our specialist, they'll let us know that you're bringing through a known donor. The doctor will remind you as well that your donor needs a GP referral, but we'll also remind you. So once we receive that referral, we can coordinate the medical and counselling appointments that are mandatory for both patient and the donor to go through. It consists of separate and joint counselling sessions. There's screening tests involved as well. Once all of that is done, it is quite similar to the process of being a clinic donor. However, there's not that grand wait time as such. So, and we can get you started with that. Please be mindful that sperm donors do need to quarantine for 3 months if you have a sperm donor. That's non-negotiable. I just want to cover a little bit more about once a donor becomes available, if you're on the clinic egg and sperm wait list. The donor team, myself and the donor team will give you a call to let you know you've reached the top of the wait list. You will complete a medical review and mandatory counselling appointments. We will offer you a profile. So the profiles they're a genetic questionnaire which cover any personal or familial history the donor may have. There's also what we call a donor information form, and that supplies things like personal characteristics such as eye colour, height, hobbies, and things like that. And so you can have a little read through both the questionnaire and the donor information form and make a decision. So once you make your decision, you are able to commence treatment. Now, we often get these questions. I just wanted to touch base while I had you all here. So a common question that the donor team gets asked is what happens if we move interstate, given that the wait list is quite long at the moment. And we just want you to know that we're aware patients need to move for work or family reasons, and we don't believe that patients should be disadvantaged in continuing their life due to prolonged wait times. So patients can remain on the wait list if they do need to move interstate for any of those given reasons, but please be aware that you will need to return to Victoria once you reach the top of the wait list and are going to begin treatment. And another common question we get is, what happens if I no longer qualify because of age? Now, as Dr. Tay mentioned earlier in the presentation, there are a few options available. So what I would suggest is to please book an appointment with your doctor here, and then they can go through the options depending on your personal circumstances. Thank you for your time today. I'm going to open it up to questions.
Thank you, Priscilla. Now, I just want to invite people, if you have questions, please pop them into the question and answer section of the Q&A section there. We have some people moderating the Q&A section, and then they will publish questions as they come through. So we might just give them a few minutes to do that, and Priscilla and I will do our best to answer questions as they come through. I just wanted to also let everybody know that we will be sending a recording of this session to everybody, and a survey for some feedback, but hopefully we have been able to answer a lot of your questions, but here we go. Questions come through. Can a family member donate an egg to us through this public system? Priscilla, would you like to take that one?
Sure. Thank you, whoever posted that question. So yes, a family member absolutely can donate to you. Please, you know, if you're already patients of the public fertility system, great, book an appointment and we can discuss further with the doctor. And then we'll also need a referral for your egg donor to come through, and we can get them started as long as they meet our criteria and they're with, you know, an Australian citizen or a permanent resident. They're, you know, within our age bracket, and they're willing to do the counselling and the screening tests. Absolutely, they can.
Okay, then we have another question about the age restrictions of public fertility care. So if the wait time is up to 36 months for donor sperm, would this make people over 40 ineligible? Juan, do you want to elaborate on that? Because I think you touched on it with your discussion about other options for people.
Yeah, sure. So you have to be under 43 to undergo treatments using your own eggs. If you unfortunately age out of the eligibility criteria while you're waiting for donor sperm, then you have two options. One option is you can consider going to another clinic, a private clinic. Some clinic will have different eligibility criteria, and most clinic will be happy to treat people up to 46 using their own eggs. The other option is to consider using donor eggs, so you can ask to be referred to our donor eggs wait list, or consider using donor eggs in another clinic as well.
Thanks, Juan. The next question's about the benefits of coming through public fertility care donor program with a known donor as opposed to doing looks like self-insemination donor program. Juan, Priscilla?
Yeah, happy to take that question.
Thank you.
Yeah. So as I mentioned before, there's multiple benefits of going through actual accredited clinics. That's for the safety of all parties involved, including the donor, the recipients, and the unborn child. This includes because we do strict screenings of infectious disease and genetic conditions. So this is to protect the recipients as well as the unborn child. Plus, with self-inseminations, it depends on a lot on your self-monitorings of ovulations. While at Public Fertility Care, we can offer fertility treatments through either intrauterine inseminations or IVF, which usually will provide a much higher chance of success.
Thanks, Juan. Priscilla, I have one for you now. What if you have an interstate egg donor?
We can definitely facilitate interstate donors. Please be mindful that there are a number of injections and scans that need to be carried out. So logistically, we can help you make it work, but they will need to come to Victoria for the egg collection, one, if not two scans. And I think you need to be mindful of how to get the medication to your donor interstate if they are going to stay somewhat interstate for the injections and then come down for the scan. So it's definitely doable, but yeah, you just need to be mindful that you need to sort of plan ahead to get the medications to them in time, make them available to travel down for scans and egg collections and things. But I'm more than happy for you, for us to have a chat and we can talk logistics. Absolutely.
Thanks, Priscilla. And then I have another one for you as well. Can you just clarify about do known donors undergo the same testing and screening as clinic recruited donors?
Yes, absolutely, they do. We have quite a rigorous screening process. Infectious diseases screening is paramount to us. So all donors, regardless if they're clinic or known, will go through the same screening process. As mentioned, sperm donors will have that 3-month quarantine period, regardless if they're clinic or known donors. So yes, they do have to undergo the same testing. However, yeah, there's not, if you have a known donor, you can start the process sooner and have access to that sperm sooner than the big wait time that we have at the moment for people on the clinic wait list.
Thanks, Priscilla. I notice a couple of people have popped their hands up. If you could just pop your questions in the chat, that would be in the question and answer section, that would be great, and we'll try and get to those as best we can. So if a patient and the donor have different GPs, does each GP send in the respective results, or does the one GP have to pair them together and send to us? I can answer that one. No, they can be sent in by their separate GPs. That is fine. We don't want to make things more difficult for people. So separate GPs are fine as long as we have a referral from a GP is all we need. Priscilla, one for you. Do you get to see the donor?
So I'm guessing you're talking about the clinic recruited sperm bank. No, we don't. You don't get to see what they look like. It is somewhat anonymous in that regard. However, you do have access to a donor information form, which talks about their physical characteristics, their parents' physical characteristics, their genetic makeup, and things like that. But no, there's no pictures provided as such.
Thank you. It's come through. Can you clarify what is meant by using someone you know for donation can take 6 to 9 months in the last slide? I think, was that you, Priscilla?
Yes, so I can clarify. 6 to 9 months, I think, is a very generous amount of time. It usually does take less. The reason we've given that is because it actually also depends on the availability of the donor themselves, the patients themselves to attend screening, counselling, things like that. So I think it's a combination of factors which can draw out the screening process to 6 to 9 months. But to be honest with you, it's usually a little bit less than people who enter the, a known arrangement aware and willing to come to appointments in a timely manner. So I think, yeah, that's 6 to 9 months is a little bit generous there. We can definitely do it in less, depending on everyone's availability and the availability at appointments. So as Katie mentioned, the first initial appointment might be anywhere between 4 to 8 weeks. So we have to factor that in as well.
Is there an age limit for my partner's sperm? So if you have a partner that's providing the sperm, is there an age limit?
No, there isn't an age limit if that is your partner's sperm. The answer is no.
Thank you. And how many tries or cycles can you have with a sperm donor?
So if it is IVF, it's a same limit to 2 cycles.
Yeah, thank you. And the costs for an egg donor process. So with everything public fertility care, there's no cycle costs related to accessing public fertility care, and that includes accessing the donor program. There are, as I mentioned, some costs associated with some of the pre-screening tests. So potentially some blood tests, some of the medications that you might need to take. But the cycle costs themselves or accessing the donors, there's no costs involved in that process. And the maximum age for a female to become an egg recipient. So we can see you up until your 51st birthday using donor eggs. All right. Oh, they're still coming through. Priscilla, this one might be for you. Are there different donor ethnicities? Sorry. late in the day for me.
Yeah, at the moment, we've got quite a number of Anglo donors in the process, and we do have a mix of some Asian donors. We are going to do another advertising campaign, hopefully in the new year, to draw some more ethnicity, so we can for a wide, broad range of patients out there. We're well aware, and we do definitely have some mixed donors in the works and coming, if that answers the question. Yeah.
And does each embryo transfer count as a cycle, or is it only the egg collections? So it is only the egg collections. Embryo transfers are in addition to that. So if you are lucky enough to get a lot of frozen embryos from the one egg collection cycle, then you can use all those embryos for no cost. Is the first appointment available to be taken via phone call as I live regional? So this is the joy of having our 10 partner sites around the state. So referrals will be sent to the local partner site, but even if those partner sites are still a long way from where you live, we do offer telehealth appointments as well. So we do offer appointments via telehealth to make the service accessible to people. Now, I'm conscious that we've run over time, but we still have a lot of questions coming in. So if people are happy to stay on, we can keep going for another couple of minutes. So, but then whatever questions we don't get to, we will send through some frequently asked questions sheet with the video recording when we send that out to everybody. Are you able to clarify out-of-pocket costs for a cycle requiring donor sperm? No out-of-pocket cycle costs for a cycle requiring donor sperm. No cycle costs for the cycle itself, no added costs for accessing donors, no bed fees, no anaesthetic fees, no storage fees. I know, amazing, I hear you all say, but it's true. Sorry. Can you please clarify the quarantine? Is that quarantine of the egg or the embryos made from the frozen eggs?
I can answer that. So it is quarantine of the eggs. So we only offer you donor profiles to view once those eggs are out of quarantine and the post-quarantine infectious diseases bloods have come back and are within normal limits. So once you create embryos, they don't have to go into quarantine and you can use them as you wish.
And what is the wait time for donors and what is the eligibility criteria? Priscilla?
So for egg and sperm, we're just saying approximately 24 to 36 months. Now, this is subject to change. As mentioned, we are going to do hopefully an ad campaign in the new year through the Department of Health. So hopefully that will bring some more donors through the door. Being a free public service, the demand for donors currently outweighs the number of donors being able to get through the process, hence the long wait time. The eligibility criteria for the donors, they've got to meet age requirements, they have to be Australian citizens and things like that. There's a lot of information on our website for whoever posted this question, and we'll include some more information about that in our fact sheets that we sent out.
And then does having 2 previous IVF cycles using your own eggs in the public system mean you are ineligible to undergo a cycle using donor eggs? So yes, unfortunately it does. It is a limit of 2 cycles per person under public fertility care, and that includes allocations of donor eggs as well. So unfortunately, yes. However, we're happy to speak with our patients to talk about other options for people and refer them onwards. Do you have to pay for counselling appointments? No. You don't. Once you're a public fertility care patient, that's all included in the workup of commencing treatment cycles. All right, I think we've hit time now, so very much apologise to anyone that we haven't been able to. Oh, there's one more that snuck in. Sorry. Is there a weight or BMI limit for participating women? One, this one's for you, please.
The short answer is no, we don't have a set limits, but we do have a guideline to help our patients to be as healthy as possible before conceptions, because we do know that high BMI increase the risk of complications and problems in pregnancy. So we do have programs to help our patients to achieve their best health prior to treatment.
Thank you. All right. Well, on that note, I'm going to thank everyone for their time and all their fabulous questions. As I mentioned, we will send through the recording to everyone who's registered to attend this evening's session, and we will send through a frequently asked questions sheet with any answers to any questions we're unable to answer tonight. So thank you again, and good evening, everyone.